Welcome to this episode of Substantial Matters, Life and Science of Parkinson's. I'm your host, Dan Keller. At the Parkinson's Foundation, we want all people with Parkinson's and their families to get the care and support they need. Better care starts with better research and leads to better lives. In this podcast series, we highlight the fruits of that research, the treatments and techniques that can help you live a better life now, as well as research that can bring a better tomorrow. Mental health problems are common with Parkinson's disease, affecting up to 50% of people sometime in their lives. Whether related to the disease itself, medications to treat it, or just accompanying the disease, the first step is to recognize the problems and then to find appropriate treatment, since many of the problems can be alleviated. As we always say at the end of these podcasts, our mission at the Parkinson's Foundation is to help you live the best possible life today, and mental health is an integral contributor to quality of life. In this episode, geriatric psychiatrist Mary Hart Bryan of the Medical University of South Carolina elucidates some of the more common mental health problems that occur with PD. The first step in overcoming them is to recognize them, then to bring them to the attention of your neurologist, and then to find an appropriate health professional, since most of these problems can be alleviated with proper treatment.
Up to 50% of people who have Parkinson's will have some psychiatric symptoms at some point in time, sometimes even preceding the diagnosis or the motor symptoms of Parkinson's. Some of the most common that we see are depression, anxiety, apathy is also common, sometimes psychosis or psychotic symptoms that we can talk about. And there are others, but those are kind of the main that we see and treat in our clinic.
Is apathy different from depression, or can they be confused?
They can. So depression is very common in Parkinson's disease. And like I said, it can even precede motor symptoms. But depression is your mood is down, you feel sad, you don't enjoy things as much as you once did, you may feel hopeless. You can have changes in your appetite or sleep patterns. So a person who's depressed may withdraw from activities and just not do the things that they once did. If someone has apathy, they may appear to be depressed because they're not initiating activities or doing things that they once did. But once they are encouraged to start an activity, they're able to enjoy it, whereas a person with depression isn't. They're not enjoying activities that they once enjoyed because of the depression. And apathy can come with Parkinson's disease. It can be a symptom. Oftentimes, the person who has apathy won't recognize the apathy and they're not bothered by it, but it can be really upsetting to their family, friends who don't understand why, their loved one isn't getting up to do the things that they once did and seems content to just sort of not be engaged in life as they were.
What kind of treatments are there for apathy and for depression?
Apathy can be a little bit harder to treat. If there's not depression, apathy won't respond to an antidepressant. Usually, rather than starting with medications to treat apathy, we'll usually just take more of a behavioral approach and really enlist caregivers, friends, and family to schedule activities and just, kind of motivate the person to get back involved in aspects of life that they've dropped off. With depression, depending on the severity of depression, there are kind of two modes of treatment. One is doing psychotherapy, and one that we commonly recommend is cognitive behavioral therapy. So that's kind of one avenue. Sometimes a person doesn't want to do therapy, or sometimes depression is more severe and also needs medication treatment. So there are several antidepressants that have been shown to have good effect in people with Parkinson's disease. There's not one antidepressant that is specifically recommended for Parkinson's, although there is some evidence that some have worked in Parkinson's disease. But, oftentimes it ends up being either therapy or medication or a combination of both.
Does exercise have any role in ameliorating either of these conditions? People always say exercise is good for people with Parkinson's just in terms of progression and the disease itself.
Yes, absolutely. Exercise is a great treatment for depression. And again, with apathy, a person with apathy may not be motivated to exercise, but when they do, they feel better. I think it definitely could help someone with apathy, but certainly with depression. It boosts endorphins, it has a beneficial effect on mood, and definitely exercise should be part of the recommendations for someone who's depressed.
Are there also potential problems of psychosis in Parkinson's disease, and how would that be treated?
There are. So, depression is very common, but we do see quite a bit of psychosis. What psychosis is can be delusions, and then there can also be hallucinations. So a delusion is kind of a belief that's not reality based, often paranoid in nature. So delusions or paranoia could be feeling like your spouse is being unfaithful or your friend is turned against you, that sort of thing. So that's a delusion. But people with Parkinson's also can have hallucinations, commonly visual hallucinations. So this can range from anywhere to an illusion, where you see an object, that's really there and it appears to be something else, to actually having frank visual hallucinations and seeing objects that aren't in the room. So oftentimes people with Parkinson's are aware that, they're having a visual hallucination. And so they're able to kind of, reassure themselves and say, oh, I know that's not real. But sometimes this can become very distressing. And at that point, oftentimes we will recommend medications for the psychotic symptoms. It's important to note that, psychosis with Parkinson's disease, it can just be a part of the progression or the Parkinson's illness itself, but also the medications used to treat the motor symptoms of Parkinson's can also, as a side effect, increase delusions and hallucinations in people that are prone to having them.
Some medications for Parkinson's disease are associated with potential impulse control disorders. As you said, there may be hallucinations. But what about underlying conditions that people just have and then they get Parkinson's disease? People have bipolar disorder or obsessive compulsive, schizoaffective. So where does the neurologist end in treating these things and the psychiatrist begins, and should they be part of the team?
Yes, absolutely. Especially, in a person that has, a psychiatric disorder, whether it be depression, anxiety, bipolar, schizophrenia, schizoaffective disorder, substance use disorders. If that person develops Parkinson's disease, it would be great to have a psychiatrist on the team, and the neurologist would most likely make that referral because it's a lot to manage the Parkinson's and then with any other complex treatment regimen that the patient is on for, their primary psychiatric disorder. And there are a lot of interactions between medications. The medications that are very necessary to help with the Parkinson's symptoms can interfere with the medicines that are necessary, for the psychiatric symptoms. And so there's a balance, and a lot of psychiatrists, particularly geriatric psychiatrists like myself, are comfortable and want to work with neurologists in managing, patients like this.
Are psychiatric disorders in Parkinson's disease under-recognized and therefore under-treated?
They are. I think in general, psychiatric symptoms, diseases are under-recognized, oftentimes because of the stigma or, people just don't feel comfortable talking to their doctors about it. Going into a neurology appointment, there are a lot of things going on, a lot of problems that need to be addressed. And so the psychiatric symptoms can kind of fall to the bottom of the list. So yes, I think they are kind of underdiagnosed and undertreated. And it's such an important part of just overall wellness and having a healthy, happy, productive life, that really being able to recognize these in yourself or having others point them out and then taking those to your neurologist is a very, very important first step.
What sort of feelings should people be aware of and bring up with their doctor? I mean, as you said, they're usually talking about motor symptoms and things like that, but quality of life depends on this entirety of experience.
Talking about if depression is there, not being able to get pleasure or enjoyment. With anxiety, anxiety can be common in people with Parkinson's, and there can be excessive worry, maybe keeping people up at night, changes in appetite, withdrawal from social activities. And then, more serious symptoms would be feeling hopeless, having thoughts that life isn't worth living, or you wish you were dead, or suicidal thoughts. Those would immediately need to be addressed with your neurologist. So it's kind of a range, but any of those would be important to talk about.
Without getting into it too deeply, but is the person with Parkinson's disease the only one affected with mood, emotional, and mental issues, or how about the care partner?
That's a really good question. So caregivers are also at a high risk of having depression, a greater chance than, someone that's not in a caregiver role. So at least half of caregivers at some point will feel depressed for a lot of reasons. Just the situation, worrying about their loved one, and it takes a toll. It takes a toll on physical and mental health to take care of another person. So we do screen caregivers as well for depression. Depression is sort of the main thing, but anxiety as well, and really encourage the caregiver to reach out and get support, whether it be a Parkinson's disease caregiver support group or mental health support, psychotherapy, or talking to their primary care doctor about possibly taking a medication. The caregiver can't be there for their loved one if their mental health is suffering. So encouraging them to take care of that is very important for the entire family.
What about dementia in Parkinson's disease? We can't get into it fully here, but what about recognizing that and treating it?
Dementia is common in Parkinson's disease. It can be a psychiatric symptom that develops. There's a lot to talk about with dementia. There are different issues that go on with dementia. There are medications that can be beneficial. I think one thing to say about Parkinson's dementia is that when people are depressed, they can't think as clearly. The same with anxiety. And so I think trying to tease out when someone is presenting with cognitive concerns, that they're not remembering things, they can't focus, is to really try to tease out initially, is there depression, is there anxiety? And if so, get those treated, because those are treatable and can reverse this cognitive deficit that patients are experiencing. Whereas there is dementia, then that does need to be addressed and managed, but in an entirely different way.
What would you say is the take-home message to people with Parkinson's and their caregivers, especially if they think they're experiencing anything we've been talking about?
My take-home message is talk to your doctor about it. For the person with Parkinson's or the caregiver, if the caregiver is struggling. And if you don't feel comfortable talking to your neurologist, talk to your primary care doctor. If you don't want to do that, find a psychiatrist, but definitely get these concerns addressed, because these conditions are treatable and really can improve quality of life when they're addressed.
For more on mental health issues in Parkinson's disease, search our website at parkinson.org on mental health. James Beck, our Chief Scientific Officer, provides a good overview about screening for mood disturbances in the article titled Mental Health in Parkinson's Disease During the COVID-19 Pandemic. If you search our library at parkinson.org/library, you'll find a list of articles, expert briefings, and past podcasts covering several aspects of mental health, including mood, anxiety, sleep disorders, social isolation, and loneliness, as well as psychotherapy, counseling, and mindfulness techniques. You can also find 4 books that address these topics titled Caring and Coping, Cognition, Mood, and Psychosis, that you can read online, download to your computer or Kindle, or order a physical copy. Throughout the Caring and Coping book are topics on caregiver stress, other mental health-related subjects, tip sheets, and a list of national and community resources. There's also a convenient contact list where you can fill in the contact information for doctors, pharmacy, emergency contacts, and many more frequently called people and services. And of course, our helpline information specialist can provide more resources. As always, they're available to answer questions in English or Spanish about today's topic or anything else having to do with Parkinson's. You can reach them at 1-800-4PD-INFO. News and updates about future events and resources are available by joining our email list at the bottom of our website's homepage. If you want to leave feedback on this podcast or any other subject, you can do it at parkinson.org/feedback. If you enjoyed this podcast, be sure to subscribe and rate and review the series on Apple Podcasts or wherever you get your podcasts. At the Parkinson's Foundation, our mission is to help every person diagnosed with Parkinson's live the best possible life today. To that end, we'll be bringing you a new episode in this podcast series every other week. Till next time, for more information and resources, visit parkinson.org or call our toll-free helpline at 1-800-4PD-INFO. That's 1-800-473-4636. Thank you for listening.